Okay, so we all know the fairy tale ending, right? Happily ever after.
Of course.
But happily ever after, it has to include health, doesn't it?
Absolutely.
I mean, how can you have a happily ever after if one or both people in a relationship are struggling with health issues?
Yeah, definitely.
So that's why today we are doing a deep dive into pre-marriage health checks.
Okay. Sounds good.
Which is something that, maybe isn't the first thing you think about when you think about marriage.
Right.
But it's, as we were just talking about, incredibly important.
Yeah, it's not the most romantic topic, but it's definitely one of the most important.
Exactly. And we're really going to go beyond just like, oh, you should get tested. We're going to look at why these tests matter, what they can reveal.
Okay.
And really what it means for a couple's future.
Yeah.
So I think sometimes, people think of these tests as like, okay, we just want to make sure we don't have any diseases.
Mm-hmm.
But it's more than that, right?
Yeah, it is. It really is about being proactive, understanding what potential risks you might be facing as a couple and making those really informed choices, before you embark on that journey of marriage and, potentially having children together.
Yeah, before making that lifelong commitment.
Exactly.
So we have some really interesting sources today. We have an article from Mr. Tuned In, and then we also have an interview with Dr. Amaka, who is a leading expert in this field. And she really stressed that it's not about fear.
Right.
It's about choice.
Informed choice.
Yes, having the information to make those decisions.
Exactly, yeah.
So let's get into some of the tests. Mr. Tuned in his article, he kind of lays out a bunch of them, and one of the first ones that he talks about is genotype testing.
Okay, yeah.
So I know that it's about sickle cell, but I'll be honest, I don't really know that much about sickle cell. I know it's a disease, but I'm not really sure what the testing is for or what it even means.
Yeah, sure. So sickle cell, you're right, it is a disease. And it's a genetic condition, an inherited condition.
Okay.
And it's linked to something called the hemoglobin S gene.
Okay.
So this gene, we're looking at genotypes, which is what you inherit from each of your parents.
Okay.
So you got one from your mom, one from your dad. And if both partners carry this gene, so their genotype is AS, you have an S from your mom and S from your dad, that means they have sickle cell disease.
Got it.
But if both parents are AS, they carry the trait, there's a 25% chance with each pregnancy that their child could inherit two S's and have the disease as well.
Okay, so it's like, even if you're healthy, you could still be a carrier and then your child can.
Yeah, that's the tricky thing about genetic conditions is you might not know that you're carrying something.
Right.
That could affect your future children.
So if let's say you're AS and your partner is AA.
Yeah.
Which is.
Right.
They don't have
the sickle cell trait.
Yeah, so what's the risk there?
So in that case, there's no risk of your child having sickle cell disease.
Okay.
But they will inherit the AS genotype from the one parent who has it. So they'll become a carrier.
Okay, got it.
So they could then potentially pass it on to their children.
So that's why this testing is so important, right? Because it's not just about...
Yes, exactly. It's about understanding your own genetic makeup.
Future generations.
Exactly. And how that might impact your family planning.
Wow.
Yeah.
Okay, so the next one that Mr. Tenda talks about is blood type compatibility.
Yes.
And I will fully admit, I was very surprised by this one.
Yeah.
Like, how can blood type, what does that have to do with a couple?
Right. So it mostly comes into play during pregnancy.
Okay.
There's something called Rh incompatibility.
Right.
And this can occur when a mother has Rh negative blood.
Okay.
And the baby inherits Rh positive blood from the father.
Okay.
So in this situation, the mother's immune system might actually attack the baby's red blood cells.
Oh, wow.
Yeah.
So that's a serious thing. Like, how do they deal with that?
Yeah. So thankfully, we have this injection called Rh immunoglobulin.
Okay.
And if this is administered during the pregnancy, it can actually prevent those complications.
Okay. So it's really about knowing ahead of time.
Exactly. If you know your blood type and your partner's blood type before you get pregnant, you can plan ahead.
Wow.
And make sure that those necessary precautions are taken.
Okay, so these are things that, like, I'm just realizing I had no idea about.
Yeah.
It's really, really fascinating and important.
Yeah, it really highlights why these premarital checks are so important.
Exactly, because this could have really serious consequences.
Yeah, definitely.
Down the line. So, okay, there are some tests that, I think a lot of people probably are familiar with, which are like the HIV and hepatitis tests.
Right.
And those are included, right?
Yeah, absolutely. Those are standard in any kind of premarital health check.
And why, I think people know, like, okay, it's good to know your status, but why is that important?
So it's important for your individual health, of course, but also to prevent transmitting it to your partner.
Right.
Or potentially to future children as well.
Right.
So early detection and treatment for these conditions are really vital.
Yeah, and that goes for other sexually transmitted infections too, right?
Yes, absolutely. Any sexually transmitted infection should be screened for.
And that can impact, obviously that can impact your own health, but it can also impact fertility and the health of your future children.
Not exactly.
Okay, so that's a lot to think about. One of the other things that Mr. Tunde mentioned in his article was fertility tests.
Yes.
So what do those actually involve?
So fertility tests are basically looking at a couple's ability to conceive naturally.
Okay.
So for men, that would involve analyzing the semen. We look at things like sperm count, motility, morphology.
Right.
For women, it often includes checking hormone levels and sometimes doing some imaging to see how the ovaries are functioning.
Okay, so this is really about knowing whether or not you're...
Yeah, it's about understanding your baseline fertility.
Right. Okay.
And if there are any potential challenges.
And why is that important to know before marriage?
Well, if you know this information early on, you can consider your options.
Okay.
If there are challenges, maybe you want to explore assisted reproductive technologies.
Okay.
Or maybe it informs your decisions about family size or timing.
So it's really about making informed choices, which is kind of like the theme of today's deep dive.
Right. Yeah, it's about empowering couples to make choices that align with their personal goals.
Okay, so, we've talked about a lot of different tests here. What if a couple finds out that they're incompatible?
Right.
Like, Dr. Amika talked about this a bit in her interview, and I know it's something that comes up a lot.
Yeah. And this is where open communication and informed decision-making are really, really important. So first of all, I think it's important to remember that when we talk about incompatible, it can mean a few different things.
Okay.
It could be something genetic, like the sickle cell trait.
Right.
It could be blood type incompatibility. It could be potential challenges with fertility.
Okay, so incompatibility doesn't necessarily mean like...
No, it doesn't automatically mean the end of the relationship.
Yep.
It's more about understanding the risks and making a decision together based on that knowledge.
So how should a couple approach this if they, get some news that they're not so happy about?
Well, the first step is always to seek guidance from a healthcare professional.
Right.
They can really explain what that incompatibility means, what the specific risks are, and what potential management strategies there are.
Okay.
Some couples, after getting that information, may decide to go ahead with the marriage and just plan accordingly.
Okay.
So, for example, if there's a genetic concern, they might pursue genetic counseling. If there are fertility challenges, they might explore assisted reproductive options.
Okay.
Other couples might make a different choice,
Right.
But the important thing is that it's a choice made with knowledge.
Not from a place of fear.
Exactly.
So it's really about having all the information and then making the best decision for you as a couple.
Exactly, yeah.
So one of the things that, Mr. Tunde talked about in his article was the importance of making these tests accessible and affordable.
Yes, definitely.
Because I think that can be a barrier for a lot of couples, right?
It can, but it's a really important point that he raises because often these pre-marriage health checks are more accessible than people think.
Right.
A lot of hospitals, labs, they offer these tests, and there are often government programs or subsidies available to help with the costs.
So it's not something that should be, put off because of financial worries.
Right, exactly. It's an investment in your future health.
Both individually and as a couple.
Exactly, yeah.
Wow. Okay, so we've covered a lot today.
We have.
And I have to say, I feel like I learned a lot.
Good, I'm glad.
I think, we talked about how important it is to have this knowledge, to be proactive.
Yes.
And to make those decisions together.
Exactly.
And that really is the key, right? It's about going into a marriage, which is supposed to be, this lifelong commitment with your eyes wide open.
Yes, absolutely. Knowledge is power, and it's about empowering yourselves as a couple to build that foundation.
Of love and good health.
Exactly.
So as we wrap up today, I want to leave you with something to think about. We've talked a lot about the medical aspects of pre-marriage health checks. What are some other important conversations, maybe not just about physical health, but emotional health, financial health, that you think couples should have to really make sure they're ready for that happily ever after?
That's a great question.
Yeah. Thanks for listening.
Thank you.
And we'll see you next time for another deep dive.
Bye.
Bye.